Hello, my name is Leanne Flowers, and I'm here today to talk to you guys about access to healthcare by the rural population. Access to healthcare is a major problem in rural communities. A large majority of our nation is considered rural, with many health disparities associated with a lower life expectancy. While health disparities can affect mutually both urban and rural residents, the data shows that rural residents have considerably lower health statuses than the urban residents do. This is a serious issue given that approximately 14% of our population live in these areas. Many factors affect access, such as inadequate or no insurance, lack of available services, and mode of transportation to these locations. These factors can lead to unmet health needs, inability to get preventable services, and costly hospital admissions. Rural communities are considered to have health professional shortage. Some unmet health needs can be medication management, preventative screenings, and routine care. Medication management and compliance has been linked to better health outcomes. Not having access to these screenings can mean that there could be costly hospital admissions. This can bring on financial burdens to both the patients and hospitals caring for uninsured. Primary health care corresponds with reduced cost, less emergency department use, and decreased disability. Timely access to health care should remain a concern for employers, health insurers, and policymakers. 65% of rural health counties are designated health professional shortage areas, and access to and receipt of quality health care is urgent policy challenges. Numerous states with large rural areas refuse to expand the Medicaid under the Affordable Care Act, and these policy decisions, coupled with geographic isolation, may continue to restrict access to vulnerable groups. So let's talk about some solutions. Some solutions to increase access to health care are, of course, increasing providers to these areas, providing special training and special services to these communities. Programs such as the National Health Service Corps and the Area Health Education Center has been beneficial for both recruiting and training of healthcare providers and staffing them in underserved areas. These programs are important for promoting and maintaining health, preventing and managing disease, and achieving health equality for all. It is important to expand services in rural communities as well as providers. Telehealth services can provide an appropriate solution for rural communities that are tackling many challenges in accessing healthcare. Telehealth is a delivery of health services via electronic and communication technology to residents that are separated by geographic, time, cultural, and social barriers. Another solution to help with this problem is to expand home-based primary care programs. Home-based primary care is intended to provide interdisciplinary medical care to people with long-term care requirements who can no longer achieve them optimally in a clinical setting. And that is why I am reaching out to you, my fellow nurse practitioners, my fellow future nurse practitioners. We can take action to prepare for care of the rural population by increasing the providers that are highly trained in rural care, telehealth, and home-based primary care. We can help by being involved in associations that are aimed at staffing these shortage areas, by taking specialized training to strengthen our skills and knowledge, and being involved. Thank you.